Anyone can get it. As many as 11 million Americans have macular degeneration, and that number is on track to double by the year 2050. It can cause severe vision loss. So you can imagine early detection is key. And Dr. Ronald Barke of Key-Whitman Eye Center joins me with symptoms you need to watch out for and treatments now available to help prevent permanent blindness. Good morning, Dr. Barke. So good to see you.
Good morning, Jane. Thank you for having me.
Nice to have you with us. Okay, 11 million people, that is a lot.
That sure is a lot of people. It's really common. It's one of the most common causes for severe visual loss in people over the age of 60. So anybody can get it, but the good news is there's a lot of risk factors that you can modify.
Okay, let's first of all, before we get to that, what exactly is it and where does it occur in the eye?
So the macula is in the back of the eye. It's part of the retina. It's where your most fine vision is focused. That's what we look at when we dilate your eyes. And if that part of your retina degenerates, it can really cause profound visual loss.
Okay, you have always stressed to us how important those annual eye exams can be. How do they play a role in catching this early, preventing bad damage? Can you talk about that for a second?
Well, the best part of treatment is prevention. And if we can pick it up early, we can do a lot more with it to treat it. So an annual eye exam is very important, a dilated eye exam. There's a variety of things that we do. We have scans that can look very closely at your retina. There's very special pictures that we can do. There is even angiograms that we can do. And if we can pick this up nice and early, then we can treat it and have a lot more success in preserving your vision.
So what are the signs or symptoms that people should watch out for?
Well, because it affects your central vision, your most fine vision, any change in your vision is concerning. And certainly macular degeneration, you can have missing spots in your vision. It can affect your color vision. A lot of times if you're if your perception is very good, if you look at a straight line, you may notice a curve in the straight line in the affected eye. So these are some of the symptoms that you can look for.
So I'm really curious, and I think what a lot of people want to know is there anything you can do to prevent it?
Well, certainly there's a lot of things you can do to modify your risk factors. Number one, if you smoke, you can stop smoking. Eating healthy, exercise, eating a lot of green leafy vegetables, antioxidants are very important. There's a lot of over-the-counter eye vitamins that have lutein and zinc. And so these are all things that you can do to modify your risk factors and help prevent it.
Okay, well, we obviously want to do anything that we can, and those are all things that are good for you just in general as well. So you see patients in Arlington and Fort Worth, but Key-Whitman has a lot of offices all over the area. Can you quickly remind us where?
Yeah, I see patients out of our Tarrant County offices in Arlington and Fort Worth, but Key-Whitman has a number of offices all over the Metroplex, so I'm sure there's an office that's convenient for you.
All right, thank you so much, Dr. Barke. Great to see you. Have a wonderful day. Enjoy this pretty weather.
Thank you. Nice talking with you.
Again, Dr. Barke sees patients in Arlington and Fort Worth. To make an appointment with him, call 817-460-2272 or visit keywhitman.com.